Hello and welcome back. So today's lecture is about having a vaginal delivery after previously having a C-section. It's called VBAC, vaginal birth after C-section, or it's also called TOLAC, trial of labor after C-section. In UK, usually it's called VBAC. In American side, it's usually called TOLAC. Okay, so both terms mean the same thing. To the learning objectives are basically to know the risks which may happen when a woman is attempting to deliver vaginally when previously she has had a C-section. And then clinically, how can we know that a woman is having signs of uterine rupture, which is the most worrisome complication that can happen when a woman is attempting VBAC. Differentiate what is scar dehiscence and what is scar rupture, and understand the risks of elective repeat cesarean section in future pregnancies. Like if a woman has repeated C-sections, what does it mean? What are the clinical implications? So in general, we know that C-section, delivery by C-section, the rates are increasing all over the world. Although WHO has set a certain criteria that I think it's 21% of deliveries, that's the upper limit, right? Should be delivered by C-section, but we know that at some busy hospitals it can be even more than 50% or even more than that, and the incidence is increasing actually. Okay, so from 2022 it shows that around 37% of births were undertaken by cesarean section in England, all over the England. Also at busy hospitals, at tertiary care hospitals, of course, we do expect this increase in cesarean section rate, because if all high risk pregnancies are referred to busy hospitals with good levels of care, then of course the cesarean section rates are going to increase. However, in general, cesarean sections, they are divided into two main categories, right? First are emergency cesarean sections, and then the next one are planned or elective C-sections. Okay, so and we already discussed the category based on urgency, like category 1, 2, 3, and 4. So why it is not good to have a C-section? I mean, what are the future risks, especially? So in future, if once a woman has had a C-section, compared to a woman who never had a C-section, she is at risk of increased risk of having a repeat cesarean section. In future pregnancies, she is at risk of having placenta previa and associated complications, which can be placenta accreta, placenta increta, placenta even percreta. So these are life-threatening situations. And even if there are no other issues, just by having a previous C-section, data suggests that there is slightly a very small increased risk of having stillbirth for otherwise unexplained reasons. And there are, of course, we expect more complications in all future procedures. For example, if a woman previously has had many C-sections, there may be a lot of adhesions. And even in future, if she's having a gynecological procedure, for example, any procedure like hysterectomy, then of course that is going to be more complicated because previously she has had pelvic surgery. So in vaginal birth, so we have to carefully select which women can have a normal delivery after a C-section. Data suggests that majority of the women, if they're appropriately selected, they can be delivered normally. Okay, we will talk about that in a later slide. But so if there is a previous C-section, in the next pregnancy, one of the criteria where we can choose her vaginal birth for cesarean section VBAC trial, that's it should be a single pregnancy. It should not be a twins. So if there is a previous C-section and now currently she is having twins, it's now she cannot have normal delivery. She should not have. Okay, so it should be a singleton pregnancy. Sorry, you have to ignore this 37 weeks. Okay, yeah, because if previously she had a C-section and now it is breech, so it's contraindicated. If the trial of VBAC is contraindicated. Okay, so The baby should be in cephalic presentation. Okay, 37 weeks does not, I don't know why I have written it, but just ignore this, because even if it's a preterm baby, right, previous c-section, it's a single baby and cephalic presentation, yes, if there are no other contraindications, you can have a trial of vaginal birth. Okay, and then who have had a single previous lower segment cesarean delivery. Remember, in one of the lectures we discussed about this lower uterine segment, because at the time of c-section, incision can be given in the upper segment. That's not ideal, but sometimes that needs to be done. Okay, so if a woman previously had a lower segment cesarean section, and if there are no other contraindications like these, then yes, she can have a trial of vaginal birth. So women who have, how about women who had previously two c-sections? Yes, they can still have a VBAC if there are no other contraindications, right? As we talked about. But it needs to be carefully, these women, they need to be carefully counseled by a very senior obstetrician. Okay.